So as part of homeostasis, we're looking at the control of blood glucose. In your digestive system, you should hopefully be aware of the pancreas being a crucial organ. The pancreas is involved in blood sugar regulation because it produces two hormones, insulin and glucagon. Both of these are going to be involved in either raising or lowering the blood sugar levels around the body. Now, food is obviously a main source of sugar. After a meal, it's digested. The big carbohydrates are digested into small soluble sugars, which are absorbed into the blood. Therefore, the blood sugar level has gone up. We know that as part of homeostasis, we want to keep a steadier internal conditions as is possible. So therefore, the body needs to respond by lowering that blood sugar level back down towards a normal level. And this is caused by insulin. So a low blood sugar level stimulates through that nervous system pathway that we've discussed many times to cause the pancreas to release this guy here, to release insulin. Insulin then causes glucose in the blood to be transferred to the liver and stored as glycogen. Therefore, that blood is being taken, the blood sugar levels are being taken down again, returning it back to normal. Blood sugar levels go too low, the opposite happens. The pancreas is stimulated not to release insulin this time, but to release glucagon, not to be confused with glycogen. Therefore, the glycogen stored in the liver is made to convert back into glucose, where it diffuses into the blood again, thus pushing the blood glucose levels higher and ultimately back to normal again. So the very important series of reactions we need to know about for the control of blood glucose. The pancreas can produce insulin and it can produce glucagon. These are both hormones. They have two opposing roles. Insulin is responsible for converting glucose in the blood into glycogen, which is stored in the liver and in your muscles. That's caused by insulin for the pancreas. Whereas glucagon does the opposite. It takes the glycogen from your stores in the liver and the muscles and puts it back into the soluble form to go into the blood. The way I like to remember this is that insulin puts glucose into your muscles, keep it there being insulin going into your muscles, whereas glucagon is used when your blood glucose has gone. Again, glucagon and blood glucose has gone. And therefore the hormones involved are insulin, glucagon, and the sugars are glucose, which is soluble in the blood, and glycogen is insoluble in the liver. We convert between the two. Very important that you can use the correct terms spelt correctly to gain full marks for each part of your question. So we then need to understand what happens when that process goes wrong. When blood sugar goes, the control of blood sugar goes wrong, you can end up with diabetes. And there are two types of diabetes. So your diabetes is described as a disease in which a person's blood sugar levels, so their glucose level, may rise to a dangerous level. This is because the pancreas is not producing enough insulin. So therefore we have to be able to treat it. And so if you're not producing enough insulin, you can provide insulin. So diabetes can be treated by eating carefully. So you're controlling your diet and the sugar intake, or in more severe cases, you can inject extra insulin. And therefore, if you are a diabetic that has to inject insulin, you'd be responsible for testing your blood sugar levels before deciding how much insulin that they have to inject. So we should now be able to work out that if a diabetic person was to inject too much insulin, their blood sugar levels would decrease, taking the glucose out of the blood, putting it into the liver and the muscles as glycogen, and therefore it could go too low and therefore be dangerous. Similarly, a diabetic must make sure their blood glucose levels don't go too high by eating too many rich sugary foods, or by failing to inject themselves with insulin, if that's the management that they use, because similarly that could also be very dangerous for them. You could quite easily be given a question where you're analysing some data about some patients with diabetes or some athletes having carried out some exercise after glucose drinks, and you should refer to the examples that are given to you in your pack of notes to answer those questions. So to summarise the control of blood glucose, we can look at this flow diagram that's on the board. We need to make sure that we are maintaining a normal blood glucose concentration. If blood glucose was to go up too high, for example by eating, then we need to make sure that we can respond to bring that down. So that means that insulin from the pancreas is released. That would then cause the conversion of glucose in the blood to be taken up and converted to glycogen in the liver or muscles, thus bringing it back down to a normal level in the blood. Conversely, if the blood glucose levels were to fall too low, for example by carrying out exercise, and that would be respiration, using up that glucose. Therefore the body would need to respond by releasing glucagon from the pancreas. Therefore, that would be converting and releasing the glycogen stored in the liver and converting it back into soluble glucose, which would go into the blood. Therefore, increasing the blood glucose concentration once again. And a similar flow diagram could be made for body temperature. Normal 37 degrees C would increase by exercise or something that being in a hot environment, causing sweating and vasodilation, pushing the blood to the surface of the skin for radiation. Or if the temperature goes too low, then shivering would take place. Redirection of the blood away from the surfaces of the skin would also take place, both working to ultimately return the body temperature back to normal. So two quite simple flow diagrams to represent homeostasis in body temperature as well as blood glucose concentrations. And so the two types of diabetes that can be accounted for, we have type 1 diabetes, where the patient does not produce enough insulin, that's insufficient insulin produced, and therefore they may have to inject themselves. We have type 2 diabetes, whereby a person is unable to respond to the insulin, unresponsive to insulin. In this case, injecting insulin wouldn't really do very much, and so therefore they have to carefully manage their own diets and exercise. Type 2 diabetes is one that can come on later in life. Type 1 tends to appear earlier in life through childhood.